sickle cell patients is Healthy Morning contributor Dr. Jane Morgan. Always good to have you, especially on something like this that affects so many people, and it's kind of a lot to walk through. So this, as I mentioned, is the first of its kind gene editing therapy to treat sickle cell disease. So how exactly does this gene editing work?
And so it works really by extracting cells from the bone marrow. They go into the lab, and then there's an editing process where parts of the DNA that are affected by the sickle gene are actually spliced out or removed.
Wow.
And then those edited cells are reinfused back into the patient. Now, it sounds simpler than it is. It's actually a multi-step process. It actually starts with a series of blood transfusions for the patient, and then those cells are extracted. While that extraction is taking place, the patient does have to undergo chemo in case some of those flawed cells are still left behind. And then after those steps, you get a reinfusion. The patient then is not over the hump. They have to stay in the hospital for 1 or 2 months, make sure those cells grow and infection doesn't set in. And also we want to give the patient a chance to recover. It's a long process, but really for the first time, we may have a hope for an actual cure.
Wow.
For sickle cell disease, as opposed to just managing these painful crises.
So what happens when you say that, you know, they have to stay in the hospital for 1 to 2 months to make sure infection doesn't occur and that the body takes it? But what happens if that isn't the case? I mean, if that's all the blood they have with these new cells, how does that work then?
Well, I think what they do is kind of just manage what's happening there, and whether or not, I guess the question is whether or not you go back for this second CRISPR technique. But the fact of the matter is your cells have already been extracted and now are lacking that gene. And so it's a matter of managing what some of those complications may be. And we have to be realistic because there can be some other complications. There were 2 patients in this study that did develop leukemia. There's always the risk of what we call off-target splicing. So you end up editing the wrong section of the DNA. And so these are all possibilities and probabilities with which we will need to grapple as this gets bigger. But 46 lucky people, lucky, were involved in this clinical trial. And I can't really emphasize that enough. Clinical trials are so important. Not only is this where we get information, but this is where people actually get access to treatment that they otherwise may not have had access to. And if you need anything further to support that, this therapy costs $2.2 million. Wow. So 46 people were able to have access at no cost to them. But everyone going forward, this is going to be $2.2 million. And so how are people actually going to be able to afford this absolutely groundbreaking therapy?
You can't put a price tag on hope, though, which this is what this is giving.
And cure and health. Absolutely.
All right, Dr. Morgan, as always, thank you.
Thank you.
We'll be back.